Okay, here we have Leanne, and she came to us about 2 months ago, and she had some really chronic fibromyalgia, which is causing pain in all four quadrants of her body. Um, she had degenerative arthritis of her hip. Were you told you needed a hip replacement in the past?
Yeah, I have one done and the other one's going.
Okay.
I used to have sharp pain, but now since the treatment in my hips, it's gone to like a dull pain and it's not all the time anymore. Where
Yeah,
before
so 2 months ago we did the laser stem cell therapy for that hip. How's it doing now?
it's doing better. I'm starting to notice relief in my hips, which is really nice.
All
And it's
right.
not all the time and I'm not having to lie down with ice packs and stuff. The LED light laser light has replaced my heating pad, so I
All
use it.
right. Could you show me your hip mobility? Could you stand up to the chair, go to the door, come back? Yeah, it's like a brand new hip, huh? Yeah.
I'm
And
thinking I won't have to get this one done.
yeah,
There must have been enough cartilage for it to be growing.
yeah.
So
So how many percent better does it feel 2 months after the procedure?
I'd say it's like um it- well, uh probably 50 or 60%
That's
better.
amazing considering it's bone on bone
Yep.
and it's only been a couple months. And remember, I told you usually it takes about 10% improvement a month. You're already 60% better. You're making outstanding progress. Okay. So,
Pain
all right.
all
So when you going back to Canada?
next week.
All right, yeah. Well, our next follow-up, we'll do it on a Zoom or phone call while you're in Canada. And when you come back to the desert in the fall, you're going to come back and we're going to do a laser maintenance treatment to keep the cells stimulated in your hip and other areas. And for and we'll go from there. I'm glad we could send you to Canada without pain. All right.
Oh, I've got a girlfriend in Canada. She wants to come next time she's here. She's in a pain clinic up there. Even when I was picking up tiles at the tile store, the fellow was telling me he's got neuropathy in his foot and he's got sciatica. So I tried to tell him about here. It's just down the street. Like I'm telling people who,
Yeah, the problem with Canada is the stem cells are not available there. So a lot of Canadians would fly down, get it done, fly back up, but you're already here because you're a snowbird. So we saved you half the round trip. Okay. Yeah.
well, not only that, most people that I mention it to think they have to go to Mexico for it. That's
Yeah.
the
That's even a further trip. And here we're doing the follow up. So we actually have live clinics and you get the follow up lasers to stimulate the stem cells to grow. Where you go to Canada, they give you the stem cells, but there's no follow up in a live sense, and there's no laser to stimulate the cells. So yeah, good decision. All right.
oh, it's the best thing. I'm so glad Sheila brought me here.
All right. So Omar is gonna use the soft wave to stimulate the cells, and then we'll see about in a couple months for your evaluation. Okay.
That sounds great. Thank you so much.
All right. Congratulations. All right.